It is important to know how to take care of your kidneys. They are responsible for filtering waste, producing hormones and regulating blood pressure. Kidney diseases are silent killers, with large impacts on your quality of life. There are several ways to reduce the risk of developing kidney disease and even symptoms if they appear. Keep fit, be active. This can help maintain an ideal body weight, reduce your blood pressure, and the risk of chronic kidney disease. Eat a healthy diet. This can help to maintain an ideal body weight, reduce your blood pressure, prevent diabetes, heart disease and other conditions associated with chronic kidney disease. Reduce the salt intake. Try and limit the amount of processed and restaurant food with salt, which includes a teaspoon per day. For cooking, you can always replace it with a low-sodium alternative. It will be easier to control your salt intake if you prepare the food yourself with fresh ingredients. Check and control your blood sugar. About 50% of people who have diabetes don't know they have it. As such, it's important to measure your blood sugar levels as part of your body checkup. This is especially important for those who are approaching middle age or older. Research shows that about half of people with diabetes will develop some kidney damage. However, this can be reduced or prevented if the diabetes is well controlled. Make sure you're checking your kidney function regularly with blood and urine tests. Check and control your blood pressure. Having high blood pressure is common, but many people who have it never know. Checking your blood pressure is important so you can be aware of the risks. This is especially important for those approaching middle age or older. High blood pressure can be detrimental to your kidneys. One study showed that high BP sufferers who also have other similar health risk factors, such as diabetes or high cholesterol, often have kidney failure. In order to lower your chances of diabetes or heart disease, it is important to manage your blood pressure levels. Normal adult blood pressure level is 120/80. Hypertension is diagnosed if, when measured on 2 different days, the systolic blood pressure readings on both days is greater than or equal to 140 mm of mercury, and or the diastolic blood pressure readings on both days is greater than or equal to 90 mm of mercury. If your blood pressure is persistently elevated above the normal range, especially if you are a young person, you should consult your doctor to discuss the risks, the need for lifestyle modification and medication treatment. The American Heart Association and the American College of Cardiology revised the guidelines for high blood pressure, 2017, and suggested that high blood pressure should be treated earlier with lifestyle changes and medication at 130/80 of a millimeter Hg rather than 140/90 of a millimeter Hg. However, not all health organizations around the world have adopted this recommendation. Best to consult your doctor. Take appropriate fluid intake. The right amount of fluids to drink depends on many factors including climate, exercise, health conditions and pregnancy. Normally this means 8 cups, approximately 2 liters, quarts, per day for a healthy person in a comfortable climate condition. It may be necessary to adjust your fluid intake if you're in a very hot or cold environment. Consumption of fluids should also be adjusted if you have a certain medical condition, like kidney or heart disease. You should consult your doctor on the amount of fluid you need to consume based on your particular condition. Don't smoke. Smoking deprives the kidneys of blood, which makes them work less effectively. Smoking also increases the risk of kidney cancer by 50%. Avoid taking any over-the-counter anti-inflammatory or painkiller pills if you don't need it. Common drugs such as NSAIDs, e.g. ibuprofen, can harm the kidneys if taken long-term. If you have kidney disease or decreased kidney function, taking just a few doses can be damaging to your kidneys. Always check with a doctor before if uncertain. If you have one or more high-risk factors, we recommend that you get your kidney function checked. You have diabetes. You have hypertension. You are obese. You have a family history of kidney disease. If you liked this video, subscribe and join the community. We also have supplements recommendation at the description below.